Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In this presentation, we're going to study our mandibular incisor teeth. Our objectives for this presentation are, number one, the location and position of these teeth, as well as their function. We're going to study the occlusion. We're going to help identify our morphology on these and the terminology that describes these teeth. And we're going to go over and review our identifying characteristics of these teeth. Our mandibular incisors are the four anterior teeth which are located on the mandible in the anterior area. And they each have numbers. We have number 23, 24, 25, and 26. Now there are other numbering systems that we can get involved into, but we're going to use the basic 1 through 32 system, which brings these out to be 23 through 26. In looking at the function of these teeth, mesial mamelon and distal mamelon. Then our fourth growth center is our cingulum. And frequently these will leave the little depressions, which is just at this stage a terminology review here for you. Your mesiolabial depression or groove and your distal labial depression or groove. Let's look at an individual tooth here, and we'll start to review at this stage our individual terminology on this. First, let's look at our incisal angles, and notice something special about our incisal angles of our mandibular centrals. This is only true of our mandibular centrals. Our incisal angles are not only very sharp and almost 90 degrees, but equal in sharpness on both the mesial and the distal. So equal, we can't identify which is mesial or distal. We'll also notice that our tooth is fairly symmetrically fan-shaped over our root, or what's called bilaterally symmetrically located over our root. It comes out in a fan shape and sets right over the root of the tooth. This will vary a little bit from the lateral. We'll go to pointing out. If we looked at the labial surface in this direction, we'd see that our height of contours are about the same. We're down in the cervical third on both our labial as well as on our lingual. A couple things that might note here, and that is that our cingulum is not as prominent on our mandibular incisors as it is in the maxillary. And we are not quite as evenly convexed on our labial surface. Our incisal edge is still over the center of the root, quite centrally located, but we have a tendency to develop a flattened area from the height of contour up to the incisal edge, or possibly in the incisal two-thirds of our central incisor. One of the characteristics of this is that it does have somewhat of a flattened incisal two-thirds on the labial surface. Of course, our lingual surface has got the usual concavity. Our height of contours, or what may be our contact areas, are located very close to the incisal edge, and again about equal on both the mesial and the distal, or the distal and the mesial. I can't tell which is which myself here. If we look over to our lingual surface, we'll find that the anatomy is basically the same. We have basically the same terminology, except that our marginal ridges are not nearly as prominent. And I turn this back and forth here a little bit, and you can try to see the marginal ridges. They're not prominent at all, really. This is almost a flat surface across here. We still term these areas our mesial marginal ridge and our distal marginal ridge, or sometimes we just will call them our marginal ridges. And we still will have a general term, which is our lingual fossa. We just never see a pit on, I shouldn't use the word never because somebody will find one, but I have never seen a lingual pit on these mandibular incisors. Very small marginal ridges and not greatly distinguishable from our lingual fossa. It is very characteristic of these teeth. If we look to our root, we will find something that is quite characteristic. In our view from the labial, we find that the root is quite narrow. Actually, the whole tooth is considerably narrower. Our crown is only 5.5 millimeters wide instead of 8.5 like the maxillary central incisor. But when we look to our dimension from the labial to the lingual, or our labial-lingual measurement, we find that this is about 6 millimeters in dimension. So actually we're broader in our mandibular incisors, both of them as a matter of fact, from the labial to the lingual than we are from the mesial to the distal. This is just the opposite of the maxillaries. And so we have a very broad root from labial to lingual and very narrow in our mesial distal dimension. This leaves for what we call a flat or a ribbon-shaped or a bow-shaped root. If actually we were to take and look at a cross-section of this, well, even before we do, let me point out what makes this what is called ribbon or bow-shaped. And this is a common groove that exists in many of these teeth. You can see it much better on this surface, possibly. And this has got a variety of names. And this can be called a depression, It can be called a groove or a concavity. Here we call it the proximal root depression, the proximal surface. It's in the root and it's a depression. Or we can call So we've got a variety of terms that this can be called, and they're all essentially correct, and various descriptions and terms will be used for different ones. Notice the total shape of our root, and that is that it comes down quite symmetrical. Length is considerably shorter than our, not considerably, but a little bit shorter than our maxillary. We're involved in about a millimeter, millimeter and a half short on our incisal cervical crown length than what we had in our maxillary central. And our overall root tooth length from the apex to the incisal is somewhat shorter than our maxillaries. But because of the crown length being a little shorter and our width being a lot shorter, it gives this tooth a long, narrow type of appearance. If we look to our lateral, and maybe the best way to start looking to a lateral is to look to it in a comparison type of shot here, we have a tooth that is a little bit broader. It's a little bit broader from the mesial to the distal. We have a tooth which has a little bit longer crown length from the incisal to the cervical by a half millimeter or so. And actually the crown total tooth length is a little bit larger. So this tooth generally overall is just a little bit larger. Our tooth has got a distal incisal angle which is rounded on our lateral and should be significantly more so than our centrals, which are very difficult to start. Fact is, our centrals are so difficult to tell apart that in our spotting characteristics we won't ask you to identify right from left in our mandibular centrals, but we will very significantly in our mandibular laterals ask you to identify right and left. One of the reasons being this distal rounded distal incisal angle, which is more rounded than the mesial. We have a situation here too in which our, let's look at an individual tooth here for a minute. Find it. Here it is. In which our tooth is said not to be completely symmetrical or bilaterally symmetrical over the crown. It's referred to as asymmetrical, insomuch as our mesial surface frequently will be a little bit